What do you think is one of the most overlooked areas of mental health right now?
Hmm. Uh, Probably prevention. We wait until people are in a crisis before offering support. Imagine if we invested half that energy into teaching coping skills, building resilience, and creating safe spaces early on. It would change the whole landscape. And again, I think that would create new avenues for people to really look more in depth into when you think of mental health.
How's technology impacting mental health, both positively and negatively?
Well, I always say technology is a double-edged sword. I mean, on one hand, it connects people to therapy apps, communities, and information, things that we haven't had access to in the past. But on the other hand, it fuels comparison, overstimulation, and a false sense of connection. The real challenge is teaching people how to use it wisely rather than letting it use them. I mean, again, it's kind of like kids and their phones, and with new technology, these apps. We try to streamline those things so that they can be very, very effective and positive for their growth. And it's the same thing when you think of these things in a therapeutic stance. So you got to be very, very careful and to use those things very, very wisely.
If you could wave a magic wand and fix one mental health issue tomorrow, what would it be?
Well, let me start waving the magic wand, and I'll say it's stigma. Hands down, stigma stops people from seeking help. It isolates them and reinforces shame. If we broke that wall, more people would step into the light and get the support they need. Again, it's you don't have to be shameful to get the support. If you need help, don't be hesitant about getting that help. And so again, it would be stigma for me.